Welcome to Everything Neuropathy. I'm Dr. Karen May, and today we are going to cover what the heck is neuropathy from a high level. So if I am the owner and physician at Momentum Health Neuropathy Center in Mason, Michigan. We're excited you've joined us. Please know that I try to give great information and an action step. Just make certain if you have questions, talk to your personal physician for detailed information. But today, let's just keep this at a high level. You may be having, or maybe your loved one's having pain, numbness, tingling. Maybe they've stepped on something and they didn't know it. Maybe that they feel like they got like a bunched up sock under their feet. Maybe they can't button their buttons very well. And you're wondering, what the heck is that? So that's you searching those symptoms took you down a rabbit hole and you got this word neuropathy. So breaking it down simply, literally, neuropathy means disease or disorder of a nerve. It's just the root words. So understand a little anatomy lesson is peripheral neuropathy means it's anything outside the central nervous system. Central nervous system means it's the brain and the spinal cord, the stuff that's housed within your spine and your skull. That's the central nervous system. Peripheral nervous system sends information out to every other area of the body. So every cell, every blood vessel, every organ, everything that else has peripheral nerves. You have 45 miles worth of peripheral nerves in your body, and they do three main things. First one is motor. Makes your muscles move and makes sure your body actually moves. The second one is sensory. So it's what you feel. It's light touch, temperature, pressure, vibration, helps you to understand where you're at physically in space as well. Pain fibers fit in there as well. And the last thing is called autonomic. It's what tells your heart to beat, your lungs to breathe, your belly to digest. That stuff that happens automatically, that's another function of the nerves. So those are the three main functions. And what is neuropathy? Again, if it's a disorder or dysfunction, what's happening? It means those 45 miles of nerve at some level, at some location, means they're getting destroyed. It means there's a process that is destroying those nerves. And what that means is there's misfires and shortening of the signal where the brain is not perceiving the information that the body should be telling it so it can respond appropriately. Think about like when you're standing in the shower and you close your eyes and you're unbalanced. It's because you took out sight, so you're not getting that sensation. It may mean like when you sit down at night and your feet are just burning. It's a misfire. It means the nerves, there's a problem within the nerve structure and the brain is perceiving it in a completely different way than what's healthy. So there's lots of different reasons and causes for neuropathy. Actually over 100. So breaking them down, ones that we see commonly in our office are, we're seeing chemo-induced. So thankful for chemo to help somebody, but the problem is it leaves destruction in its wake. So chemo-induced. We also see surgical-induced and trauma-induced. That happens to be what mine was. There is also diabetes. It means all that extra blood sugar that the body can't process attacks the nerves. There's medication induced above and beyond chemo. There's some medications and even combinations of medications actually attack the nerve as well. So there's lots of different reasons for people to have neuropathy, but understand neuropathy is chronic. It's a chronic condition. So it feels, that's chronic pain and numbness and tingling in a body part. It's not something that's called acute, where you've only had it and maybe there was trauma and you have a pinched nerve in your back, maybe that there was a compression injury somewhere. It's not something that's usually acute in nature. It's slow in its onset, and then it builds up and is progressive over time. Now, mine personally it's a subset of different types of disorders. Mine was called Parsonage-Turner syndrome. It's a crazy surgical complication, in my case, that no one could predict. And my body destroyed the bulk of the nerves on my right and dominant side. So each person has a different level as to what happens and how it happens. But the treatment is, when you go to your medical doctor, can still be the same. They may do an EMG to see if it's coming out of the spine or somewhere else. They maybe do like a skin biopsy to see how many nerve fibers are in that little biopsy. They may do an ultrasound or an MRI to check to see if there's anything that's compressing on the nerves. But otherwise, treatment, maybe they'll do some blood tests to check to see like B vitamin levels, but otherwise treatment's still the same for them. Medications for pain and some physical therapy to help if at all possible. So pain is just one of the indicators, and the medications only block pain, but they don't heal and repair. I have a couple different videos on the details as to breaking down the nerve fibers, so catch that one. Also, I have another video on doctors telling you why nerves can't heal, so make certain you catch that one. But I'm going to tell you, yes, nerves can heal, but it takes effort. And so in my own case, I was desperate because my doctors told me there was nothing that could be done. So that's the reason why I put together the process that we have at Momentum Health Neuropathy Center, is to do healing from the inside out and then use external equipment to speed that healing process up. So you'll always hear me talk about using food as medicine. Improving blood flow to those nerves is vital. And then we can use external equipment that is FDA cleared to physically speed up that process of circulation and physically rebuilding the nerve if it's what's indicated in your type of neuropathy. So here's your action step for today. Fill out the quiz so you can understand where your neuropathy is at. Subscribe to our YouTube channel because you can look at all those other videos and nutritional videos as well to go deeper, that you're going to get great information with some action stuff. And the other thing is do not hesitate to reach out and give us a call. My team would love to understand your journey with neuropathy because your relief starts here. Have a great day.